By way of follow-up, we said we would send you an outline of where we've been with this course and how it developed. The course started about 7 years ago when we decided that traditional laparoscopic skills training was inadequate, and we came up with a program which offered protracted training using take-home trainers. These trainers, as you can see here in these few slides, were made from storage boxes and other equipment, and we put together a program of both lectures and skill sessions. The boxes were very plain and made from storage boxes from DIY stores. The exercises were extremely basic but reproducible and probably of very high quality, or fidelity as opposed to quality, but nonetheless repetition was what the name of the course was, and we encouraged everybody on the course to repeat the exercises ad nauseum at home. This, for example, is an ectopic or an ovarian cyst exercise where we placed a liquid tablet inside a balloon with some multi-purpose glue. This then was utilized within the surgical trainer, where the outer balloon was peeled off the inner one without spilling, and it mimics quite well an ovarian cyst. The take-home training was core to this course. It is core to this course. There's internet backup. We see candidates monthly, usually for somewhere between 4 and 6 hours. And we also do an informal assessment on a monthly basis. At the end of the course, we have quite a comprehensive exam, which consists of multiple choice questions about electrosurgical safety and things like that. We also have practical skills training. We also have used virtual reality simulators as part of a research program to compare the box with that modality of training. And the winner, the overall winner, was crowned our Lap Olympian. And this was proved to be quite enjoyable and quite successful. The curriculum itself was broken down broadly into 2 areas of both didactics and skills, and you can see some of the topics there that we have covered during the course, and we'd encourage anybody who is embarking on creating a course that this will be the best method of approaching skills training, not just to focus purely on skills but also other elements of laparoscopic training. We now have a purpose-built centre in the Coombe Women's Hospital, and this is furnished with height adjustable tables, fixed monitors and the simulators. All participants now get the Lapar trains going home for the 4 to 6 months of the course, and with the internet backup they're able to come, learn new skills and come back on a monthly basis having practiced at home. The other interesting thing about this type of training is that you can set up a simulation lab anywhere. This was in the exhibition hall in Bournemouth at the Association of Surgeons of Great Britain and Ireland, where we were able to set up a lab for trainees attending that particular meeting over a period of 3 days, and the ASGBI asked us to spend some time there with their trainees. We now have, I think, a course that is proving itself. We nationally in Ireland have seen a major uptake in laparoscopic surgical procedures by gynecologists, and indeed the 2010 data on ectopic pregnancies now shows that only 12% of that type of pregnancy is dealt with by way of laparotomy, and we'd like to think we had some role to play over the last 5 years or so in changing how things are done on a national level, and I think this course has that capability. The other thing that's worth mentioning as well is that we have partnered with industry, and these slides are showing some of our colleagues from industry who come in to give us some talks on electrosurgical safety, and also about setting up and troubleshooting in the stack systems. We also asked these colleagues from industry to help us with the assessment at the end of the course, and I think this is quite novel and unique, and I think it's well worth doing, as it does improve the knowledge that our trainees have with respect to fixing the problems that occur and avoiding the complications that can occur. So we make no bones about it. We make no apologies for the fact that we start with the most basics. We have everything from camera training, which this slide demonstrates, where zooming in and out, etc., is taught, and then following instruments in and out of the simulator. In between, then, we will intersperse the skills with talks on, for example, the creating of the pneumoperitoneum, with videos of the Hassan or other techniques for gaining entry into the abdomen and creating the pneumoperitoneum. The skills are basic, but nonetheless, with repetition, the hand-eye coordination of trainees does improve. This is just another simple exercise using a pre-tied loop, which is then secured around a water-filled glove finger. We also can teach our trainees to tie these particular knots and use reusable knot pushers, and this considerably reduces the cost of this type of training exercise, as these loops do come at a cost from the company. This is a simple appendix exercise where the appendicular artery is clipped and divided, and then an end loop placed around the finger in a fashion that would happen with an ectopic pregnancy. And I think these skills are generic to both gynecology and surgery, and I think it's simplistic but also quite effective. Suturing, I think, is seen as the holy grail of laparoscopic surgery, and many believe that if you can suture laparoscopically, you can pretty well do anything else. These exercises, or these clips of images, show that we do take them right the way through to laparoscopic suturing, but unlike some, we believe that this is the culmination as opposed to a skill that can be learnt, which will then trickle down to making the candidate familiar with other exercises. We think that there should be a gradual build up to this rather than just teaching this and a trickle down from it. We also upload to our website various talks which have video and audio overlay. We use a particular software called Camtasia, and this is just one of those talks on ergonomics, and this is simple software that we could help the London Deanery with, and that your experts and trainers should be able to put together their own talks for their trainees. We have a section then where we upload papers proving evidence for various aspects of laparoscopic surgery and of interest. We recently have published ourselves on this area and continue to publish with respect to take-home training, and interestingly, the American Journal of Surgery in November also carried a paper evaluating take-home training, and also it has shown that this is a worthwhile methodology of training. More recently, we've introduced the ability to record what the trainees can do in the simulator. It's a simple digital video recorder which is attached to the camera, and with a simple remote control, the candidates can then record what the activities that we need to see. This can be kept for assessment or can be used as a logbook of their training. Again, in recent times we have introduced video conferencing. This is demonstrating a candidate that we've recently had in London attending our course, and I think this is something that will prove very useful for larger audiences and larger training groups, and this is something that we would be willing to assist the Deanery with, and I think it will help those working in centres possibly away from London to attend various training sessions. We have a website which backs up all of this, all our skills, all our videos, all our talks, all our PDFs are uploaded into this. We can create various courses for various groups, and we can also upload content into this. Again, this is something that we should sit down with the deanery and possibly talk about, the creation of videos and content for this. Also, interestingly, this website, or this type of virtual learning environment, which is a Moodle platform in the case that we use, can be used for the setting of quizzes and assignments, and again, this is something that we can explore with those that are trying to construct courses. So in summary, we think we've come up with a robust, high fidelity system which is eminently malleable to the needs of whatever group we are catering to. It is a take-home training system. The skills are progressively more difficult, and overall I think this provides a very cost-effective solution for laparoscopic skills training. We look forward to working more with you in the future, and we'll talk to you soon. Thank you very much.